Good afternoon and welcome to the UCD School of Medicine webinar where our faculty will discuss the range of radiography and diagnostic imaging courses that we offer. If you have any questions during this presentation, please feel free to add them to the Q&A function and we will we'll try and answer them during the session. There will also be some time at the end for questions. So thank you again for taking the time to join us today. And I would now like to introduce Dr. Shane Foley, Associate Professor, Head of Subject for Radiography and Associate Dean for the Graduate Thought Studies for the School of Medicine. Thank you, Shane.
Right, thanks very much, Jean. And you're all very welcome to today's webinar. It's really just to give you a short overview of some of the offerings we have here in the School of Medicine, in particular to the radiography and diagnostic imaging session. So maybe just very quickly, as by means of introductions, as Jean mentioned, my name is Shane. I'm the Head of Subject and also the Associate Dean for Graduate Talk programs here. And I'm joined on the call here by a number of my colleagues who hopefully you can all see on screen here. So they'll probably be appearing in different orders for you, but we have Adele Thomas, who's our Program Director for our CT Postgraduate Program. We have Catherine Delp, who is our Director for our Interventional Radiography Program. We have Nadine Abou-Rous, who is our Director for our Professional Certificate in Radiation Safety. And we'll also be shortly joined by our colleague Alison McGee, who is our Director for our Postgraduate MRI Program. And they're the four programs that we will be introducing to you today. And really just to give you, I guess, really an overview of the programs, what they involve, and maybe some of the practicalities of applying and what's involved within them. So if it's okay, I might just start by a very short, quick few slides on, I guess, our school and where the program sits. Obviously, you've all expressed an interest in maybe some of our programs, but just to let you know where, I guess, our section sits within the School of Medicine. And in my own role as the head of the subject, my task is really to oversee the quality of our programs, and I think we take great pride here in UCD and the whole academic team in terms of the quality of training we provide, which is renowned across Ireland, but also far beyond that, and that will be attested by many of our graduates to date who have come from far and abroad to study here with us. So our section sits within the School of Medicine. You can see the building here on the screen, which is quite a large, and well, we used to call it a new building, not so new anymore in the whole campus of UCD. We're nearly 20 years old now at this stage, but it's the really, I guess, strong points to the building is that it actually houses most of the healthcare professionals in UCD. So it's very much an interdisciplinary building, and it supports not just education, but also research and much social interaction between all our different students. Within the building, we have this medicine students, nursing, radiography, physiotherapy, as well as our other undergraduate and postgraduate programs. And the School of Medicine actually sits as just one of the schools within the College of Health and Agricultural Science, which you'll see here on screen. So it's part of a bigger, I guess, network within the university scaffolding. So today's purpose is really just to give you a bit of guidance on some of our offerings. They're not all of the offerings. We just couldn't possibly fit them all into a single 1 hour webinar, really. But really just wanted to point you towards where most of the information is housed in terms of our postgraduate offerings. And it's all via the UCD website. So I'd encourage you all to first, please go there. You can see the URL on screen here. For our graduate offerings. You'll see that the graduate offerings are listed for the school, and radiography and diagnostic imaging is one of them. And then obviously we have within the radiography offerings a range of different programs. So you can see we've kind of grouped it into CT, MRI, ultrasound, other specialists, and also some CPD programs. Okay, so the vast majority of the information should be available to you within the UCD website, so please do go there. What we plan to do really over the next hour is to highlight some of the programs, some of our more popular programs, I guess, and some that people seem to express most interest in. And we'll try and walk you through some of them. I'll just remind you, as Jean let you know to start to please do feel free to ask any questions via the Q&A function, even during the course of presentations. And what I'll do in the background is keep an eye on our questions coming in, and either myself or the program director for the program will do our best to answer your queries and hopefully help you out in understanding our programs a bit better and make it and hopefully help you to make an informed choice, I guess, should you be wishing to apply to our programs at their next offerings, which is likely be for September. Okay, so we're going to start with our first program, and that's the Professional Certificate in Radiation Safety. So I'm going to hand you over to my colleague, Nadine, who's going to walk you through that program. Stop my sharing now, Nadine, so you should be able to share your own. You might just turn on your microphone as well, Nadine.
Oh, sorry about that. Thank you, Shane and Jean. And good afternoon, everybody, and welcome to today's webinar. My name is Nadine, and I'm presenting the program Professional Certificate in Radiation Safety. So I'll start by outlining some of the key components and essential information on how the course is organized, what the course is about, and what you will learn. So this is a 10-credit program. It's a 4-month duration. It's part-time and completely online learning method. And this program, you will learn about the physics and units of radiation and dose measurement, methods of dose reduction and radiation safety guidelines and best practice. You will learn about you will develop a deeper understanding of national and international legislation governing radiation safety in your country, understanding how you fit into it as a professional and how you apply it effectively in your work life. Also, to critically evaluate radiation safety policies and procedures in your profession, understand your role within them, and hopefully to examine current issues in radiation safety and apply these to clinical and industrial decision-making and problem-solving process. So unique selling points of the program. So here are some of the main reasons why you should consider this program. It's part-time course tailored to the working professional. So you'll have plenty of time between assignments and you can do evening and weekend submission as well. It's completely online. It can be completed anywhere as long as you have access to internet. And also, this program is the only professional certificate program in radiation safety currently available in Ireland. The lectures are created by and delivered online by leading medical and industrial radiation safety experts, as well as academic experts in physics. And in terms of assessment, there is no end of semester exam, but it will be continuous assessment throughout the course. So why you need to take this course? You can take this course if you want to improve your knowledge of radiation safety and legislation, to understand better your role in radiation safety and develop skills and knowledge to become a better radiation safety officer, to be able to effectively apply this knowledge and skill in your role for effective problem solving as well. So this program or this course attracts participants from a variety of backgrounds and training. So in terms of entry requirements, you are eligible to apply for this program if you have one or more of the following. So if you have a BSc in Radiography, BSc in Radiation Therapy or equivalent, if you have BSc in Physics or equivalent, if you are an individual named on the General Register of the Medical Council or on the Register of the UK General Medical Council, if you are named on the Register of Dentists held by the Dental Council of Ireland or on the Dentist Register of the UK General Dental Council, if you are a nurse registered with NPORD Alternates, and finally, if you are an individual named on the Register of the Veterinary Council of Ireland or in the register of members of the Royal College of Veterinary Surgeons. Also, if you have a good standard of education, minimum leaving certificate or equivalent, but with evidence of ongoing training in the area of radiation safety and professional experience in a field utilizing ionizing radiation and operating under current legislation. In Ireland, it's SI 256 and SI 30 for diagnostic exposures, or international equivalent if you are not from Ireland. And one important point is that beside your education background, you must be currently employed in a facility which uses ionizing radiation within the state, regulated and licensed by the Environmental Protection Agency of Ireland, or within similarly regulated and licensed facilities internationally. And of course, to demonstrate a commitment to continuing professional development within the realm of radiation protection. Also, to be computer literate, we don't expect you to be expert in computer, but to know how to use this platform, because the whole course is completely online, and to have continuous internet access for the duration of the program. So here's some of the frequently asked questions. How long is the course? This course is 4 months. January offering is from January till May, and September offering is from September to December. Another question, can I start the course when it suits me? The course has 2 offerings, as I just mentioned, and the assignments are time due at certain times during the course. So if you join January offering, you need to start on January. Can I still use on-campus facilities, example, the library, gym, etc.? Well, once you are registered, you are a UCD student, so you will have access to all the students' amenities during the course, even though you don't have to come to attend any lectures in campus, but you still have access to all the campus facilities. So if you have any question other than those, you can directly email me or email our administration office. Thank you.
So we're going to move on next to Idel. So Idel is going to present on our postgraduate programs in computer tomography.
Thank you very much, Shane and Jean as well. And everybody's very welcome here this afternoon. I'm just going to give you a quick overview of the postgraduate CT programs that we offer here in UCD. Good afternoon, everyone. I'm sorry for the delay there in getting my slides up. You're very welcome. My name is Idel Thomas, and I'm the Program Director for Postgraduate CT courses here in UCD. And I'm just going to give you an overview of our program here in CT in UCD. So we actually have 2 programs. So the first program that we have is a graduate diploma program, and the second program that we have is an MSc program in CT. So this slide just shows you sort of an overview of the structure of those 2 programs and when each of them occurs and which modules are involved for each of the 2 different programs. So firstly, I'll just start off with graduate diploma in CT. So this is a program that students do where they would do 60 ECATs or 60 credits of learning. So they start off in the autumn trimester of year 1, and they take 2 modules, which is professional practice of CT1 and technology of CT1. So the technology is worth 10 credits and the professional practice is worth 20 credits. And then in the spring, those students as well would go on and they would do the next 2 modules, which is professional practice of CT2 worth 20 credits and technology of CT2 worth 10 credits as well. So at the end of that stage in May of the following year, after a student would start, they can step off with the graduate diploma having acquired 60 credits of learning at that stage. The MSc program runs along the same pathway as that. However, students will complete an additional module of 30 credits the following year, so in autumn of year 2. And this will enable students who want to stay on and do the MSc MSc to be able to go along that pathway. So they have that final 30 credit module at the end of that time. So the two professional practice of CT modules, they would focus on things like professional practice, clinical practice. The first professional practice of CT1 module, it focuses on things like neuroimaging and spinal imaging. So the students would study different topics relating to the head, the neck and the spine, in relation to clinical practice and how to do protocols. What does pathology look like in the images? What is anatomy like in these regions as well? For the technology of CT1 then, the students will start off learning about the basics of CT technology, about the scanners, about image production, image display, and then they go on in the second trimester, in the spring trimester, by advancing in all of those areas. So the professional practice of CT2 module, then the students would study body imaging at that stage. So all of the organs, all of the trunk, legs, arms, and different things like that in terms of their professional practice. And also with technology of CT2, they go further in relation to learning about radiation dose and optimization in CT, quality assurance in CT, facility management, and so on and so forth. And the third final autumn trimester that you see there, with 30 credits, students would undertake more complex topics in that trimester. So more in relation to maybe cardiac CT, perfusion CT imaging, dual energy CT. And they also undertake a clinical project as well, that they would work on throughout the whole trimester as part of their assessment, where they would go in a little bit deeper into one of those topics that would be relevant to them themselves in their clinical practice. So some of the unique selling points of the program is that there is a blended learning and a flexible delivery to the student learning. So blended learning in that there is a mix of different lecture types or different methods. So some of the lectures are face-to-face, sometimes there's group discussions, sometimes there's e-learning for the students to do, and sometimes there's image appraisal or image evaluation for students to do. So many students also find that it's flexible because they come into UCD for 3 days a week, and then on the fourth day, usually on a Thursday, they do some online learning and they have online classes. So that provides a degree of flexibility during each block week, where the students spend, I suppose, a good bit of their time up in UCD, so they can mix with the other students who are there on the program as well. But also on the Thursday, they have that flexibility of doing that learning from home. So the students also have a unique opportunity to get hands-on image processing sessions during this program as well. So we do image review sessions, image reconstruction sessions with students as well, where they can get involved in that image processing and ultimately sort of enhance their clinical knowledge, and it provides support for their clinical knowledge as well on the topics that we are doing during that trimester as well. CT in UCD is also the only professionally accredited IRT program in Ireland. So the students who do undertake our programs, the graduate diploma or the MSc programs, they have that accreditation from the IIRRT. So the program does foster very high standards for academic, clinical and research skills that we want our CT radiographers to develop as well. Quite often then, they have opportunities to go into more senior roles, having done one of the CT programs, or going into other different sort of options and areas where they can further their career as well. So why take this course? I suppose one of the good things about the course is that there is that time up in UCD where radiographers get to meet other radiographers who work in CT as well, and to chat to them. Like, there's that opportunity for peer dialogue, to learn from other radiographers what is happening in other sites, what other scanners are like, and so to share all that clinical practice information and dialogue with each other is really really beneficial to the radiography profession as a whole, and for each individual person as well, in terms of their personal development and in terms of their growth. And we find students do really like coming up to UCD, and they do get a lot from interacting together as well. Another reason to take the course is that students will learn advanced knowledge about CT optimization. So we're all very familiar with the radiation dose that CT can impart onto patients. So it's very important to have the proper training and skills to know, how to optimize the scans for each patient. So that sort of topic is covered in actually across all of the modules, and sort of intertwines between all of the modules as the students go through each of the programs as well. There's also a good lot of topics relating to the technological advances in CT, and even AI CT and more advanced CT reconstruction as well, that students will get to benefit from in their clinical practice as well. And we also get the students to develop clinical reasoning and image appraisal skills. And again, this is another area of the program that students do find very useful and that they actually enjoy. So sometimes there's not a lot of chance or opportunity when they're working in the busy departments to do a lot with the images, or to do a lot of image appraisal, or to develop those skills. So they get the chance to do that while they're here in UCD as well. So some of the frequently answered questions that students may have, or that you may have as potential applicants, would be, do I need a clinical placement to undertake the CT program? Yes, each student who comes on the CT programs does have to have a clinical placement in place, because we do confer clinical competence on our students. They do clinical learning throughout the whole program. They do clinical hours, and they are also supported in their clinical placement by a clinical supervisor as well. So they do a clinical assessment, and all of this can only be done when a student has a clinical placement in a department in Ireland here to undertake CT for the duration of the program. So this really ensures that the learning outcomes for the program are met by each student, and that they are developing their clinical skills alongside the learning that they're getting here in UCD as well. Do I need any prior CT experience to starting the program? Yes, we do want applicants to have a minimum of 3 to 6 months of time working in CT prior to starting the program. It gives a good foundation and a base to students, so that when they actually start coming into lectures, that they are then, familiar with the basic terminology and the basic running of the modality, and that can enhance their learning as well. So if you've any further queries relating to the CT program, I'm happy to take them in the chat if you want to put any questions in there. Or indeed, you can contact us on graduate.imaging@ucd.ie. So thank you very much.
I'm going to move on next to Alison, who's going to present you on our postgrad programs in MRI, or magnetic resonance imaging. So over to you, Alison.
Thanks, Shane. Good afternoon, everybody. And as Shane said, I'm going to talk to you a little bit about the MSc MRI programs and the Graduate Diploma MRI program at UCD. So essentially, these programs both aim to offer radiographers working in MRI the chance for a high quality learning experience that allows them to integrate theory and practice issues with respect to MRI as they work towards developing academic mastery of the subject, enhancing their own clinical competence, and also furthering and advancing their professional development, both during and beyond their studies here at UCD. So the program, as you can see, has sort of two components, and they generally run seamlessly from each other. Initially, students would undertake 6 modules, which would ultimately lead to a graduate diploma in MRI, and this would be completed over a calendar year typically, starting from September and ending at the following August. Students who would then like to continue and undertake the MSc MRI will then undertake a final additional module in the autumn trimester that focuses on advanced MR imaging. So as I said, the programs, both programs run seamlessly. It's possible to begin with the graduate diploma if you wish, and then also apply then at the end of that during the summer period to continue your studies. So you don't always have to make the final decision at the very start of the program in terms of which of the programs you wish to complete. So in the context of the course itself, then student learning, they have the opportunity to engage in a range of different learning and assessment opportunities through engagement with lectures, both online and in person here at UCD. Also through completion of online quizzes and surveys, through engagement with different types of assessment. And we utilize various types of assessment strategies throughout the different modules of the program. Again, aiming to ensure that what we ask students to do in some way relates to and enhances their clinical practice. So that is one of the primary aims of our program, that what students learn will inform best practice and allow them to progress within this imaging modality. So in terms of the dates for the 25-26 academic year, these are available on the calendar tab at the above website. So you can look at the dates for the planned lecture block weeks. So then in terms of what's studied over the course of the program, so you can see that the first 2 trimesters, broadly speaking, there are 2 technology and 2 practice modules. So in terms of technology of MRI then, so each of these modules obviously it deals with the underlying physical principles that underpin MR image acquisition and enable students to understand the principles of the images that they look at and use to evaluate pathology effectively. So we will also explore the aspects of MR scanner design, its function and management. We'll look at MR signal formation, the image weighting and contrast characteristics, artifacts, their origin and limitations, and of course, aspects of safety and facility management. And these topics are sort of spread across the 2 technology modules. So the first module very much is an underpinning of core principles, and the second technology module develops those further, particularly in the context of fast imaging, fast body and vascular imaging, and the variations in sequence design, etc., that are needed to support those scanning techniques. The practice of MRI modules, practice 1 focuses on brain, spine, ENT, musculoskeletal imaging. Practice 2 then focuses on body imaging, so abdomen, pelvis, vascular imaging. So students will learn about the various justification processes and approaches to scanning these regions. They learn about the pulse sequence types and their role in demonstrating both normal anatomy and the appearances that would be reflective of pathology. To enable students then to consolidate their learning, there are 2 practical clinical practice modules then that run during the summer period. So during this period, the student learning is very much self-directed within their clinical department with support, tutorial support from the UCD teaching team to sort of keep them on track. So it's a chance for students to think about the knowledge that they've gained and apply that in the clinical environment. Also to undertake a practical assessment within their department to show how they've integrated the knowledge that they've gained on the course into enhancing their clinical practice and optimizing efficiency within and safety within their department. So students of the graduate diploma will finish at that point. Students who wish to continue their studies then undertake the final module in advanced MR imaging. This module is directed mainly at what we're calling sort of advanced MR imaging techniques that may not necessarily be undertaken across all hospital sites. For example, advanced neuroimaging, breast imaging, applications of 3T and higher field strength imaging, the role of AI in MRI, aspects of audit and how they feed into enhanced MR imaging practice. So that sort of reviews the content of our programs. So in terms of the selling points then, in that it very much allows students to link the principles of what they're learning to their their work within the clinical department, to their work as an MR radiographer. That is a primary driver of our teaching and assessment process, that students are encouraged to demonstrate this in a variety of different ways. The programme also has a blended learning approach. We have some lectures delivered in person here at UCD and also a number of online days. So typically in a given block week, there might be 2 or 3 days at UCD and then 1 or 2 days online. So that can provide some flexibility for students, which might increase their ability to undertake the programme and to balance the work and study demands. In terms then of looking at why should I take this course? So because of the focus on this link between theory and practice and what is the evidence base for MRI and the practical clinical assessment, the programme very much confers clinical competence in MRI. And we find that many of our graduates go on to take on senior roles within MRI in their own department, or they move on to other departments as they advance in their career. The next important point in terms of undertaking the course would be it provides an opportunity again for our students to integrate their skills with specialist knowledge. And this is very important to enable them to bring back aspects of what they've learned here at UCD to share with their own colleagues at work and enhance the in-house training that they provide to other radiographers. It allows them to evaluate scanning protocols, to review aspects, factors that influence MR safety. And it allows them to demonstrate those skills, which they can then bring back to their individual departments. So it allows them to develop this evaluative approach to safety and safe scanning practice, to image review and facility management. So hopefully it will allow them to improve and enhance both themselves in terms of their knowledge and their competence and skills, but also make a difference within their own imaging department. Commonly asked questions then in terms of, do I need to have experience in MRI? So as for the CT programme, yes, we would normally expect applicants to present with between 4 to 6 months of scanning experience in MRI prior to starting the course. The reason being that experience will allow them to have a better insight into the topics that we will begin discussing in the Technology 1 and Practice of MRI 1 modules. We find it's nearly too steep a learning curve for applicants to come in with very little previous scanning experience. Then sometimes applicants ask if they need to be working in a department that undertakes the full range of possible MRI examinations, and the answer is no. It may be a case that, for example, if you happen to work in a department that doesn't undertake cardiac imaging and you're undertaking the MSc programme, it may be possible through recommendations from staff here at UCD and your own RSM CSR that you can arrange a visit to a site that does undertake cardiac MRI. Okay, so you have some insight into the practicalities of running a cardiac MRI service. But it is not necessary to be scanning the full range of examination types in order to undertake this course. So I hope I've given you a little bit of an insight into the programme structure, the topics addressed in the various modules, and highlighted some important reasons why it might be useful to undertake this course. And again, any queries can be addressed to me at the email address displayed. Thank you.
Hello to everyone. My name is Catherine and I'm looking after a graduate certificate in interventional imaging. This course has been running for it's very successfully now for about 10 years. And it's a level 9 course, and that's 30 European credit transfers associated with, that's 30 ECTS. And this course is specifically designed for radiographers that are currently working in the interventional radiography suite and who want to develop their knowledge and expertise in this field. And because of this, applicants should have at least 1 year's post-qualification experience and be working in the interventional department during the duration of the course. Okay. So it actually consists of 4 separate modules, and you can see them here. So they are radiation safety, technology of interventional radiology, patient care and interventional procedures, and cross-sectional anatomy. So radiation safety would cover the principles of radiation protection and safety protocols, the current policy, and your role within these policies. Technology would explore more the physical principles and technological advancements in IR, including cone beam CT as well. Cross-sectional anatomy looks at providing comprehensive knowledge of anatomy that's all relevant to the interventional room. And then patient care and interventional procedures focus on disease processes, infection control, procedural risks, patient consent, and patient outcomes within the interventional suite. Okay, so it's delivered over 2 trimesters, and it commences every year in September. Okay, so the first term, it runs from September to December. And in that term, you cover the first 2 modules. So that's radiation safety and technology of interventional radiology. And in the second term, from January to May, you cover the patient care and the interventional procedures. And you also cover cross-sectional anatomy. The modules here, they're designed so that students can have a look and learn more about the area they're actually working in, and then possibly use the information to see how their services run and have a greater understanding of how that the service that they provide is going to affect the patients. Oh, I've skipped the last slide, haven't I? Sorry. So what's unique? This is the next one. Yeah. What's unique? It was the first course in interventional imaging in Ireland and the UK and in the EU. And it's one of the unique selling points of it that every year as well, we have a significant number of students from international backgrounds. And this course has just gathered an awful lot of interest internationally. Okay, and it's for one of these reasons that this course is 100% online. Okay, all of the lectures are pre-recorded and they're updated annually. And then they're released on a weekly or bi-weekly basis. Okay, and you could look at any of the lectures at any time that suits you. Okay, you can replay the lectures, you can make your own notes during any time for the duration of the course. So it really is kind of aimed towards the working individual. Okay, and there's also some notes available and some useful links that accompany the lectures as well. And these are all available on Brightspace. Now, Brightspace is UCD's online platform for delivering online lectures. Okay, so there's actually no commitment to attend UCD at any stage at all. Okay, all the content is taught online and it's accessed online. So it makes it ideal for clinical sites and international students. And I know in clinical sites, it's very difficult to release staff or students to come to UCD. So all you really need for this course is access to a computer and internet connection. Okay, but that doesn't mean we don't talk to you at all. We do like to touch base just to make sure that everyone is okay and they're able to engage with the course and the content in the course. So we do support a few live, non-mandatory interactive tutorials, pretty similar to what we're doing today. And we have a little chat with whoever's on the course. We can have discussions in peer groups, and we can prepare you for the assessments that are coming up. So again, no commitment. There's no new content delivered during these online tutorials, but it's a really useful discussion point, and you get to know that you have a bigger learning community out there. Okay, all your peers will be on this as well. Okay, so regarding the assessments, so the assessments are varied within each module. Okay, so every module has got their own way of assessing you, and they can be in the form of an assignment. So this could be a written essay, it could be a video assignment, or it could be an audio assignment. Okay, and these are all submitted on Brightspace again. The other option for assessment would be an online quiz. These could be image-based or they could be multiple choice. And again, these will be hosted on Brightspace. Okay, and there will be certain deadlines for the submission of each of these. But again, we've given ample time to allow for the completion because we know you're all working individuals doing this. So because up to this, there was actually no postgraduate education in interventional imaging, this course is specifically designed for radiographers who are working in the interventional suite and who want to know more about patient presentation, the types of procedures, and the prognostic value for each of the procedures, the disease progression, outcome for the procedures, consent. This is a changing environment that we're looking at the moment. radiation safety, and we all know that IR can lead to some of the highest doses of radiation in the radiology department. It's really good. It's really designed for radiographers who are working, and we do really stress this because we might ask you to reflect on your own practice and evaluate your own practice and write up some case studies. Okay. So some frequently asked questions. It's run annually and starts in September. Successful candidates would finish in May. It's approximately 9 months to do the course, and it's spread evenly over the 2 trimesters. The applications are online and close mid-August, and they are all through the UCD applications portal. Applicants must hold a BSc in diagnostic radiography or similar from your country. And you must have worked in our interventional suite for a duration of 1 year prior to the course and, of course, during the course, as we'll be using the case studies. Can I use the UCD facilities? I think Nadine touched on this earlier. Yes, you can. There's no need to be in UCD at all, but you can avail of all their online facilities like the library and online student events. And for those of you who wish to visit UCD, you can avail of all the campus facilities. That includes the gym, the shops, the library as well. Okay. Next question. If I have completed one of the modules previously, if you have completed one of the modules previously as part of another certificate or as a standalone module, you can apply for a recognition of prior learning. And if this is granted, you may be given certain exemptions. Okay. So I hope that was a pretty good overview. It was pretty quick. I think I have covered most of it, but I'm here if you want to ask any questions at the end. Thank you.
Nice. Thank you, Catherine. It was clear for me anyway, if that's any reassurance. So great. So essentially the floor is open now for any questions. There are our 4 presenters for today. So what you'll have, I guess, seen and heard is that we have, well, today we showcased you intentionally 2 online offerings, our professional certificate in radiation safety and also our graduate cert in interventional imaging. So these are fully online programs that you can avail of. Our other 2 programs are CT and MRI ones because they have clinical modules associated with them and require clinical experience, clinical exams. They do require attendance in Ireland, okay, and they are delivered mostly in a face-to-face. So just to clarify that for people. I know the questions are still coming in, so I will keep an eye on them. I just wanted to clarify that. And also just to remind people that obviously we've just handpicked a few modules that we thought might be of interest, but of course, our radiography and diagnostic imaging section has a range of other postgraduate programs. Many of which are in ultrasound. I'm just sharing on screen for you now some of the offerings in ultrasound, which are also quite popular and may well be of interest. And also we have them across a range of other topics. So all of this information, whether it's a professional certificate, which is much smaller in volume of academic content, to a graduate certificate, to a graduate diploma, to a full master's, or even a PhD, are all possible here with us in University College Dublin. So I would encourage you, as your first protocol, to please look at our website, which has most of the material and details on our offerings. And then, of course, should you have any questions, you're more than welcome to follow up directly to the email address shown on screen here, which Atty kindly manages and monitors for us.